Hello, everyone, and welcome to today's presentation on how to accentuate the positive in advocating for equitable health insurance coverage for individuals using pre-exposure prophylaxis, or PrEP. My name is Samantha Leal-Pepe, and I'm excited to share strategies that can enhance our advocacy efforts in this critical area of public health. Overview of the skill. Accentuate the positive. To begin, let's define the advocacy skill of accentuate the positive, which is a key component of survival skills in advocacy efforts. This skill involves highlighting our achievements and recognizing the contributions of others in the community. It is crucial for maintaining motivation and fostering a supportive atmosphere within our advocacy groups. Publicly acknowledging small wins can significantly boost morale. Relation to course material. In the policy process, accentuating the positive is essential for creating compelling narrative. By focusing on our successes rather than the challenges we face, we can resonate more effectively with stakeholders, including policymakers and community members. For instance, when advocating for PrEP, we can highlight successful case studies that demonstrate significant reductions in HIV transmission due to improved access. Application to a specific group. Now, let's explore how to apply this skill specifically to individuals using PrEP. Effective strategies include compiling data that shows decreased HIV infections in communities with accessible PrEP coverage. Additionally, sharing success stories through community events and social media campaigns can help create a positive narrative around PrEP and its public health benefits. Legislative context, HB 2769. Let's consider the legislative context surrounding the issue. One important bill is HB 2769, which addresses discrimination in health insurance based on an individual's use of PrEP. This legislation is vital because it tackles the issue of insurers denying coverage or charging higher rates to those who use PrEP, creating significant barriers to accessing preventive health care, as highlighted by Ward 2025. Power imbalance and public reaction. In this advocacy scenario, it's important to recognize the power imbalances at play. Insurance companies and policymakers hold substantial influence over healthcare access. The groups most affected by this discrimination include LGBTQ plus individuals, particularly gay and bisexual men, as well as other marginalized populations. However, there are others who may be affected by this legislation but do not necessarily benefit directly. For instance, healthcare providers may experience changes in how they offer services or how they are reimbursed for providing PrEP. Additionally, pharmaceutical companies could experience shifts in market dynamics, depending on how insurance coverage is structured. Public reaction to HB 2769 has generally been supportive, particularly from advocacy groups focused on LGBTQ plus rights and public health. Yet, concerns have been raised about the financial implications for insurers, reflecting conflicting values regarding individual responsibility and social support, as noted by the National Association of Social Workers 2021. Legislative intended impact. The intended impact of HB 2769 is to eliminate discrimination in insurance coverage related to PrEP use. By mandating the insurers cannot deny or limit coverage based on PrEP status, the legislation aims to promote equitable access to preventive health care, ultimately reducing HIV incidence in our communities. This aligns with the critical theory perspective that advocates for social justice and the challenges existing power dynamics. In conclusion, by applying the skill of accentuating the positive, a vital survival skill in advocacy, we can effectively advocate for equitable health insurance coverage for PrEP. This approach not only supports the health and well-being of vulnerable populations, but also contributes to broader public health goals and the reduction of HIV incidence. And on this slide, you'll find references for materials cited throughout the presentation. Thank you again for your attention.